Hello, my name is Danae Kawamoto-Duran, and I'm a postdoc researcher at the Hague Laboratory. Thank you for the opportunity to present. Radiation therapy for cancer treatment has advanced tremendously in recent decades. However, radiation-induced fibrosis, or RIF, remains a major long-term complication. RIF is characterized by excessive scarring, impaired wound healing, and structural changes in the extracellular matrix that can impact both function and appearance. In our study, we investigated differences in incisional wound healing between irradiated and non-irradiated skin, specifically using an exogenous mechanical loading model in order to mimic the hypertrophic scarring often observed in human wounds. We used 45 adult female mice, dividing them into 4 experimental groups. 1. Non-irradiated without tension. 2. Non-irradiated with tension. 3. Irradiated without tension. And 4. Irradiated with tension. The irradiated groups received a total of 30 gray of fractionated dorsal radiation to induce chronic skin fibrosis, modeling post-radiation conditions seen in patients. After 6 weeks, each mouse received a standardized 2 cm incision in the dorsal region. In the tension groups, we applied a distraction device that gradually widened the wound by 2 mm over 6 separate cycles, simulating mechanical forces commonly experienced in healing human wounds. Tissue samples were also collected at 1, 3, and 10 weeks post-incision for histological evaluation. Our histological analysis revealed significant differences in wound healing dynamics. Irradiated wounds exhibited increased collagen deposition and disorganized architecture compared to non-irradiated wounds. Wounds under mechanical tension developed broader scar widths, especially in irradiated skin. We also used Doppler imaging to assess vascularity. Our imaging showed reduced perfusion in irradiated wounds, with the lowest vascularity seen in wounds under both radiation and tension. Together, these findings highlight that radiation impacts fibrotic responses during wound healing, particularly when combined with mechanical tension. The use of tension in our model mimics physiological stress on healing tissues, making this model highly clinically relevant. Looking ahead, we also plan to conduct single-cell RNA sequencing in order to identify key fibroblast subpopulations driving fibrosis in irradiated skin. We also plan to perform biomechanical tensile testing in order to assess the structural integrity and strength of the healed wounds over time. By deepening our understanding of radiation-induced fibrosis, we hope this model will inform future therapies in order to improve healing outcomes for patients undergoing radiation therapy. Thank you very much, and I'd like to thank my team at the Hague Laboratory.